hypertension is pretty important. It's a risk factor for that. If you're looking at what's going on, hypertension and diabetes are very common. I'm going to talk today about how common hypertension is, what it is, how you find out if you have it, what you can do about it, and maybe more importantly, what you can do to prevent it, which no matter what you do with hypertension, the prevention and the first things to treat it are pretty much the same. I think I learned a little bit about hypertension, like Roy said, during practice, and it was after doing all the training. I got some information on hypertension through the checkout line in Publix by reading the common medical journals at the time, the Star, the Globe, the Inquirer. And the reason I'm saying they're important, and actually I'm not kidding around about this, I kind of noticed every week when I went through the checkout, there was the new cure for arthritis. And every week it was a new one. And you sometimes I'd call it a 3-card match to my wife. I said, look, the Star, the Inquirer, the Globe, they all have the new cure for arthritis this week. And the next week they'd have the new cure for arthritis that would come out. So that kind of told me something. And I was a little bit jealous being a nephrologist, okay? How come they don't have a new cure for hypertension every week? It's never in there. Well, it kind of told me what the difference was between the two. First of all, as many people have hypertension, probably as arthritis. I think as almost everybody in this room knows, we have some aches and pains when we get up in the morning. Hypertension, you don't feel a thing. There can be 50 to 90 million people in this country with hypertension, but they don't feel it. Arthritis, you feel it. Hypertension, in addition to being silent and having a large number of people, differs from arthritis in the following. Your complication from arthritis is more pain, or if a doctor gets hold of you, more complications. Treatment for hypertension are medications which in the past had a good number of side effects, and you wouldn't necessarily say thank you to your doctor for them. You might even get one of the headlines in the Inquirer, "My husband was a zombie," or "Man wakes up after 5 years when the wife finally figures out it's the medications the doctor gave you." But they can make changes in that, and as Roy knows, in the last 20, 30 years, the number of medications have changed drastically. If you don't treat hypertension, you run into some complications like Dr. Crandall probably told you about, that by this point, they're a little bit harder to treat than to prevent, and that's why prevention with hypertension is so important. Arthritis, you still have the pain, but you can take some medications for it and that's it. All right, now first of all, what is hypertension? A real simple answer is if you get your blood pressure taken and your pressure is over 140/90. It's easy to check. You should get it done. How do you do it? Well, you want to get more than one reading. You don't want to get one reading where you're 145 and a doctor gives you medication. You want to have several readings over several weeks, and you want to have a pressure that's over 140/90. Do you go on medication then? No. I'll get into treatment in a minute. You can have a pressure that's somewhere in the range in between. They call it pre-hypertension. And with that, you're going to have pressure somewhere over 120 to 139 for the upper number, 80 to 89 in the lower number. Do you need to go on medications? Usually not, unless you have diabetes or some other complications or have had a heart attack or some of the things Dr. Crandall brought up your prior 2 lectures. You don't necessarily need to go on meds, but you do need to go on some basic things to do with your lifestyle modification, diet modification, looking at the medications you're on, changes that you can make to avoid needing to go on medications in the future. And you can have some success with that, and I'll get into those probably here toward the end, and I'll answer any questions you have about it. Okay, so how do you determine blood pressure? Well, Dr. Cacciaguida and an RN here will be happy to check pressures for you. You pretty much, again, it's silent. You very rarely get symptoms of it, or if you don't treat it for years, you start to get complications from hypertension. So how do you tell it? How many people have it? Okay, very common, I mentioned. There's probably at least 50 million out of 30 million people that have hypertension in this country. 90% of that is totally silent. The only way to get it is by checking your blood pressure. Over the age of 60, you should have that done about once a year. It's pretty important to do it. It is, again, something you're not going to pick up unless you check it. It's easy to do. They'll show you how to do it. Publix is a good one for it. If you get a high pressure, don't panic. Get a second opinion. Paramedics do a good job. An RN does a good job. There is white coat hypertension. Watch out for that. What are some of the things you should watch out for with it? Okay, complications of it. If you don't treat high blood pressure, you can later on down the line develop problems with strokes. You have a 6-time-fold risk of having a stroke if you have untreated hypertension. Heart failure. You have a 4-fold increase of heart failure if you don't get it treated. There are other things like aneurysms. High blood pressure can cause kidney failure. It can also cause problems with your vision if it's untreated. If you're a diabetic, all those complications happen a lot quicker if you don't have your pressure controlled. What do you do about it? What do you do to avoid it? Okay, first things that you want to do are lifestyle modifications. If you're overweight, you want to lose weight. Okay, that's pretty easy. Easy for me to say, not easy for somebody to do. Some people I have in the office, and Roy can say it, you'll have someone come in on 2 or 3 meds, like he'll have somebody referred to us who they're having a hard time getting their medication down. 2 or 3 meds, blood pressure's up. Person gets serious, or their spouse gets serious about it and won't let them eat, and their weight goes down, 20, 30 pounds. All of a sudden, the person who can't control their blood pressure is on 1 med or no meds, and it's very easy to treat like that. You also turn around and look at other things like alcohol intake. Now, 1 or 2 drinks usually is not a problem for most people for blood pressure or for other risks, for heart disease, diabetes. You run into the occasional person, they have 1 drink and their blood pressure goes through the roof. Well, you don't need a study to tell you that doesn't work for you. So just notice if that's a difference. Tobacco can raise increased blood pressure. It also makes diabetes worse. Tobacco, there's no place for tobacco in what you're doing. Look at the medications your doctor's giving you and what you're taking. Now, I mentioned arthritis. Advil, Aleve, Motrin can cause your blood pressure to go up. Sometimes just switching off that can lower your blood pressure, or can take the medications that you're on and lower the need for them. Cold medications, dietary supplements, oral contraceptives, medications for weight loss. These can all raise your blood pressure, so you want to see if you're taking those. Your diet, what do you want to do with your diet? Besides weight loss, you want to be on a lower sodium diet, most people. It's pretty easy to follow what you're getting with that. Some people are much more sensitive to salt in their diet than others. The black population is very, very sensitive to salt. If they cut it down, it's good. A lot of people can take salt. There's nothing wrong with salt as something you put in your food. But if you notice that it's raising your blood pressure, you really need to cut down on that. Other foods to eat. Recently, it's been like a re-release of something that's been known for over 20 years. If you have higher potassium in your diet, the potassium will help to lower your blood pressure. It may not be much. It might be 2 or 3 millimeters of mercury, but it might be enough to keep you off medication. Calcium in the diet. There was one point it's considered maybe our problem isn't too much salt in the diet, it's a lack of calcium in the diet. And if you get a little bit more calcium, it helps. I have nothing against somebody taking a calcium magnesium pill. One of those twice a day might actually help to lower it. Your potassium doesn't have to be usually supplemented by a pill. You can usually just get by eating more fresh fruits, vegetables. Tomatoes are good. Potatoes and steak have a lot of it, but there's other things that has in it. So, fresh fruits and vegetables will give you a little more potassium, a little less sodium, and that will lower your blood pressure. So changes in your medication, watch the medications your doctor's giving you, ask them about those, changes in the foods that you take. All right, now, you have it, you're part of a very large group in this country, you know what you can do short of going on medication, exercise. Exercise, I didn't mention that. I think that's pretty obvious. Exercise can help to lower blood pressure also. Some of these things you can do and you can avoid going on medication. But let's say you're still seeing your doctor and you become one of those 50 to 90 million Americans where your blood pressure is high. You try all those other things I mentioned, then you may have to look at going on medications. That's a whole story to itself, but I will tell you of the medications that are there, diuretics, beta blockers, calcium blockers, what they call ACE inhibitors. They're all good medications that can be usually taken with just one pill only. Very few people need more than one. Most of these pills do not have as many side effects as they've had with some of the other medications in the past, but they all do have their own side effects. And I'm not going to list every one of them, but I will answer questions on them. But as you take these, usually you can get your blood pressure under good control with all those other things that I mentioned that you want to change. Summing it up, hypertension is very common. It's very easy to find out if you have it. There are a lot of things you can do before you go on any kind of medical treatment. Don't just take one reading and do something with it. If you have hypertension or you're pre-hypertensive, just keep an eye on it and don't ignore it. If you get a reading that's not high, don't just say, I don't want to have this, I'm not going to look again. Burying your head in the sand is a bad way to treat it. And Roy and I have both seen people who try to do that over the years. It's best not to, just look at it and face it. Usually you can get by without medication. Any questions right now? And I can talk more about complications and meds if you like. Yes?
Does hypertension cause atrial fibrillation?
If it's very high, it can cause atrial fibrillation on its own. But atrial fibrillation is such a common thing in this country. If you want to know some of the things that are taking over, atrial fibrillation, diabetes, hypertension, obesity, we see more and more of that every year, and we really should see less. Now, if your pressure is very high, you can go into atrial fibrillation all on its own with that, but that's usually getting up there. Most of the treating hypertension that I'm talking about is really trying to change your risk for developing atrial fibrillation, strokes, heart attacks, heart failure, things like this. Most atrial fibrillation is not caused by any of the above. It's just, they call it idiopathic. It just happens, and we're seeing more and more. And some of the medications you go on can actually control the rate for hypertension or decrease your chances of getting it again. Yes, sister?
Why does that cause hypertension?
It blocks certain things called prostaglandins in the kidneys that lower hormones that normally will raise blood pressure. Now, as you know, your response to a medication isn't necessarily the same as the guy next to you. I have a lot of people who take drugs like that and they're fine with their blood pressure and don't have high blood pressure. But if you have high blood pressure and you take it and you notice your pressure's going up, it affects the hormones in the kidney, the prostaglandins. It also causes more salt retention and can raise your blood pressure some. You can very often, you'll get somebody who's under control and they start taking it and you'll see their pressure go up even 10 or 20 millimeters of mercury. Do they need more medication? Well, once you're on a medication, you're getting a side effect from a medication like that. First thing you think about is changing that medication. Once you start using meds to treat other meds, boy, you're getting into something very complicated. Once you get on 4 or 5 medications for whatever reason, you don't really know what's going on. You kind of give the person a pill and see what happens. That's not a good way to do it. So drugs like that, Aleve, Motrin, Advil, they can all raise blood pressure. If you take it and your blood pressure is okay, fine. But if it's not and it's getting out of control before you raise the meds, maybe you're going to have a little bit more pain and all you can use is Tylenol for that arthritis pain. Yes?
Does taking a low dose aspirin every day help prevent hypertension?
It doesn't prevent hypertension itself, but it's really good for cardiovascular disease. A few things on it. Some people should be on it, period. If you have two or more risk factors for heart disease, okay, and I'm sure Dr. Crandall went into those. If you smoke, if you have diabetes, if you have high cholesterol, if you have a family history, if you have hypertension. You can throw a few other little ones on the side to that, but if you have those, being on aspirin is a good idea. It doesn't affect those hormones enough. If you're on an 81 milligram baby aspirin or whole aspirin, it won't raise your pressure by itself, but it does have some benefits to avoid blood clotting, and it can prevent progression of arteriosclerosis. One thing on aspirin, if you are taking aspirin, don't just stop it. Somebody who's taking aspirin for reasons they thought was a good idea, their doctor said you need to take this, or even more important, if you've had a heart attack, you have a stent in place, don't ever stop it without being very careful about it. The incidence of people having a heart attack stopping aspirin after they've been on it a while is fairly high, within even 6 weeks. So it won't cause your pressure to go up very much, but stopping it can be a problem if you've decided to go on it for whatever reason. Any other questions with it? Yes?
I've always had low blood pressure, which I'm grateful for, but I experienced a bout of high blood pressure when I found out my house was sold, and I was
What was stolen?
overwhelmed with anxiety about how I was going to get through it. And it went up to 145 from like 110 over 80. Is it emotion? Can emotions raise it that high?
Yeah, emotions can definitely raise high blood pressure. It's one of the reasons you don't want to get one reading and walk out of a doctor's office with a medication in your pocket. You know, if you're checking pressure, you want to make sure that it really is high. That's why I say you want to get several readings over several weeks. If you're even high then, it's very reasonable to take 3 to 6 months, unless it's way high. Now, way high by a doctor, our official number that we look at is 200 or 210 over 120. That person goes out of our office without symptoms on a pill. Roy and I might go 180 over 100 or 110 where we get uncomfortable, or if it is that high, we have them come back in a few days to check them again. If you're 145, you know, on a few readings, get several readings. Take 3 to 6 months to do these other things of exercise and watching your diet. Take a calcium magnesium if you want. Go on a low-fat diet. What are the other things I mentioned here that you can do? You know, exercise, weight reduction, low-fat diet, low-salt diet. Pardon me? More potassium in your food, more fresh fruit and vegetables. Take 3 to 6 months to see if you can get it down without a medication. Don't forget, these medications will have some side effects in a large number of people. Don't get frustrated if you get side effects, because you can usually work through that now. When Roy said, when I started in practice, there is a whole slew of new medications now that have fewer side effects and fewer we really look at them now. We look at cholesterol levels, uric acid levels, other things in your blood to make sure we're not causing problems rather than helping them. If you have an occasional high blood pressure like that, though, don't go on a medication unless it's way up there. You know, work on the other things. Don't have your house broken into. Yes?
Go into some of the side effects of the high blood pressure pill or the blocker.
Yeah. Every single one of them has something. When I brought out the National Enquirer, I look at some of them. I never read it really very much. I'd look at some of them, and I was hoping to see one, you know, my husband was a zombie, you know, as I said, and the wife changes it when you go to the background. Some of the old medications and the new ones, they all have their own side effects, and I'll give you some. The diuretics. I mentioned diuretics, calcium blockers, ACE inhibitors, and beta blockers. The diuretics can cause a significant but small increase in cholesterol. It can cause muscle cramping. The hydrochlorothiazide actually can cause impotence more than the other drugs. The beta blockers can cause slow heart rate. If you get on the wrong one, it can make you very tired. You may tolerate beta blockers for years, but you'll hit a certain age where you don't metabolize it the same, and you start to get more tired, more worn out. Heart rates can go down. You have to stop it for that reason. Small increases in cholesterol with some of them actually lower it. Calcium blockers, if you're a diabetic, you may not want to go on those. They're like the diltiazem, cardizem, verapamil. The new ones are amlodipine, isradipine. these drugs will sometimes, in a diabetic, you have to be careful. You don't want to give it to somebody who's just had an MI because it can cause a lot of problems with that. The ACE inhibitors, I'm a nephrologist like Roy. We love those. They're great. If you are a type 2 diabetic, you almost want to be on one right off the bat. It lowers your progression of renal failure, decreases your chances of it, can help with heart failure. Side effects, though, are a cough and high potassium in your blood if you have some renal failure. The dry cough is there. That's one of the things that I kind of learned from the National Enquirer, and I learned from patients coming in the room. When those drugs first came out, you'd have people come in with these crazy complaints of a cough. Well, it wasn't one of the side effects. You didn't see that. Well, the drug was out for about 2 years, and I sent more than one person to a pulmonary doctor when I couldn't figure out why they were coughing. And it turned out those drugs actually have an enzyme that works 2 different ways. And it blocks that enzyme and can cause cough. They have the angiotensin receptor blockers now, which are similar, but they give the same benefits, but without the same side effect. So you are going to buy a side effect profile with some of the medications. The thing is, with changes in dose and changes in medication, you can usually get around most of those. Now, I talked a little longer on that, but you know, they're all there. And yes? No? Okay. Yeah.
My husband had a very low level of hypertension, and like 145, and we put him on it. Scared him, basically.
Put them on what?
Scared him because he had only 145 and he only had the one read. And I think what you're saying is really, really wonderful. I'm going to share it with you. Maybe you can see it. Because he has a leg cramping and a few other things. He's very, very athletic and he eats very well. But I think that he's even had a little bit of hearing loss, but maybe that's not a side effect. But he doesn't really take medications other than that. I can only say that over 7 years I've noticed changes. Plus he says that he's turning down his hearing aid for me.
There's 2 things you brought up real important with that. Actually 3. Let me go to the side effect. Hearing loss. There is one that can affect your hearing of the diuretics. And it's not one we usually use for hypertension alone. The thiazide diuretics, the hydrochlorothiazide or chlorthalidone, usually don't do it. Spironolactone, triamterene usually doesn't do it. The ones they call the loop diuretics, which are like, the trade name is Lasix, in very high dosage you can have decrease in hearing. Now, you also have to look at the age we are in. Get over 60, hearing does start to go down. But high doses of the diuretics like furosemide can affect your hearing, and that's not necessarily reversible. We used to think it was, but not necessarily. That's usually, though, those type diuretics we don't usually use for hypertension alone. They're usually used with somebody with heart disease as well. So that's usually furosemide. The level of blood pressure you brought up, that's a whole load of more information that you kind of touched on. Where did they come up with this number of 140/90 anyway? Okay, and how come it matters for most people? This was worked out years ago before I ever went to med school, and it was a Framingham study, and they showed that people that ran pressures over that tended to have more heart disease, more strokes, did poorer, and didn't live as long. They also found out with a study I think called Mr. Fit, probably, 30 years ago, Roy? That intervention with these medications could actually decrease it. And they didn't know where to draw the number, but they started to see that mortalities over 140/90 for whatever reason were higher, and they started seeing more heart disease, more strokes, more fatal and non-fatal myocardial infarctions. So they started to see this. That's where they came to the 140/90. More recently, they started to see with certain groups like diabetics, maybe that number needs to be lower, 130. 130 over 85 or 80. Those numbers are still in flux, and they keep looking at different studies. The most recent one was the ALHAT study, which kind of confirms those numbers and shows that treatment does really help, even if 145. But you want to get more than one reading. You don't want to be perfectly fine at 138/70 or even 145, or somebody coming in with a real bad thing where their pressure is 160. You don't want to go out on a pill with that. But those numbers that they came to were looked at not just a few hundred or a few thousand, they were tens of thousands of people they looked at to try to get a number. Unfortunately, you deal with treating statistics, but each person is different. Same with all the medications that you brought up. Yeah.
Is there a time of day that the pressure is more likely to be high?
Yeah, that's pretty neat. When would you guess would it be the highest? Okay, well, somebody's been looking. What time in the morning? When you first get up and you're trying to get the kids out of the house? Or I'd say that'd be the highest time in my house. Okay, 4 o'clock in the morning, believe it or not, it is the highest blood pressures if you look at a general population is 4 o'clock in the morning. When do you think the highest incidence of having something like a heart attack or stroke is? What time of day? 4 o'clock in the morning again. You don't think that it's going to get you in your sleep, but no, I mean, that's overall average. You know, these things can hit any time of day. I can't believe my blood pressure is highest at 4 in the morning. I think it has to be around 7:15 to 7:20, you know, but, you know, that's when your pressure is the highest. You don't want to get your pressure when you're under pressure. How do you check blood pressures? Okay, when you want to check blood pressures, you want to be calm, relaxed, you want to be sitting. Let's get into details. You don't want to have a full bladder when you're getting your blood pressure taken. We have somebody comes in the office, we say, do you need to use the restroom? And their pressure's sky high, you know, when they were fine. Bladder's empty, you're comfortable, you're not cold, like some of you might be here this morning, which will raise blood pressure. You want to be sitting down, you want to have your arm out, you get it more than one time. You check the blood pressure in both arms. The one that counts is the higher one, by the way. And the reason that is, you can have blockages in blood flow to one arm or the other, and the one you're looking at is your central high blood pressure. So if this one says 140 and this one says 130, you can't take your favorite one. You can't say 130. You have to go with the higher number then. Okay, there could be some weird things with blood pressure. We'll get incorrectly high readings. You got to make sure the cuff fits. You got to make sure the cuff is the right size. If you're very large and we're using a general cuff like the one Roy has over there, you're going to get an incorrectly elevated reading. If the cuff doesn't fit, you can get if you've got a smaller arm, it'll be incorrectly low. So you want to make sure your reading is correct and you have a good reading. And sometimes you're better off if you don't have your doctor taking it. The nurse is better. If you go in the office, you will see if they've got good technique, they start talking to you about the weather or what you're wearing or what's your daughter doing or how's this. It sounds like they're trying to be friendly, but they're actually trying to get you to calm down and relax to get a good reading. You don't want to walk into the doctor's office cold, your doctor an hour late, you got an appointment with somebody else in 30 minutes, your bladder's full, sit down there and put your arm out. Oh, you've got high blood pressure here, I'm going to increase your medications. This stuff right here, it'll turn you into a zombie, but your pressure will be fine. You don't want to get your reading like that. Get a second opinion. Okay. I think all the things I wanted to fill in, everybody's filling in with questions. Yes.
Once you're on medication, is it possible to go off? You've been on it for a long term?
It's possible. One of the reasons you want to be careful is that somebody really has hypertension is it's usually a long-term commitment to being on that medication. High blood pressure isn't like some lab results where somebody's 5% outside of the normal on a bell curve. We actually, how can you get a bell curve with 5% of the people over the population? Well, we don't. Because of this study in Massachusetts, the Framingham and the Mr. Fit and the All Hat, they showed beyond this pressure, you start to run into certain diseases. If you're going to be treated for it, though, you're usually on it for life. Now, does that mean you're going to be on this one medication and you're not going to change it? No. You keep track of it. And with certain lifestyle modifications that you've all asked about, sometimes you can get down or even off these medications. You're not going to be on the same medications for for years and years and years. It's not like that. This isn't thyroid disease, another one that never makes the National Enquirer. Okay, you know, there's more thyroid disease than there is diabetes, but how come nobody knows that? It's because you find the person's low on thyroid, you put them on the medication. Nowadays, we check a level a couple of times a year, and the person is perfectly fine. Diabetes, there's a lot involved in treating that. Hypertension, you're going to be making changes, and people don't realize that. You're going to be up on the medications, down on the medications. Somebody asked about side effects like the beta blockers, which, you know, you can be on it for 10 years and all of a sudden you can't tolerate it anymore. So you do have to make changes. And one of the changes is you may be able to get down on the medications, off the medications. In general, though, most people who start on blood pressure medications are on them for life in one form or another. Can you get off? All the time. Most times not. What other questions? Any others? I had a whole list of things, but I think you covered it with most of your questions. Okay, about 30 minutes. Okay, I'll leave this up to Roy, and if you want to get your blood pressure checked, they can check it for you here. I'd advise you, if you don't even normally go in to see a doctor, check your pressure about once a year. And paramedics do a good job, nurses do a good job. Doctors tend to scare you, especially if you don't want to go on a medication.
I thought
All right.
you'd do a better job on selling the nephrologists as the hypertensive experts, but you didn't even mention that. Basically, nephrologists, the kidney is the primary organ that creates hypertension due to hormonal and salt and water balance changes. And nephrologists, I think, are the experts in hypertension. So if you have a hypertensive problem, see a nephrologist.
Oh, gee, Roy, okay.
Thanks for an excellent lecture. And
You said we have some thyroid disease conditions in this country. Can an imbalanced thyroid cause
Yeah.
hypertension?
Yeah, definitely. Uncontrolled hyperthyroid. Uncontrolled hyperthyroidism can cause hypertension. It can also cause AFib. Okay, somebody has atrial fibrillation, make sure you've had your thyroid checked. It's not uncommon you find it like that. Thyroid disease, you know, high cholesterol. Make sure somebody checks your thyroid at one point. That's a very common cause of it. There is more thyroid disease than diabetes. It's just much easier to treat, not many long-term side effects if you treat it. Diabetes, if you treat it, you know, you've got a much more intensive disease to treat if you want to treat it correctly. You know, you can not check your level if you have diabetes for years. Sooner or later, you'll get into problems, same as if you don't check your blood pressure. Nephrologists run into really high blood pressure. Some of the other things that can cause it. Now, pretty much what I'm talking about is essential hypertension, and that's 90 to 95% of the hypertension you see in this country. You can get hypertension by some other rare causes. Hyperthyroidism is one, but you treat it and it goes down. You can have blockages and blood flow coming out of the heart from a congenital problem. That can give you high blood pressure. You can have certain hormone problems that can cause pressures to be very high. And you can have a blockage, as Roy mentioned, the kidneys. If you have kidney disease, your pressure will be high, period, almost always. And if you have a blockage from arteriosclerosis, same as you can get heart attacks and strokes, you can get kidney disease from that, and not just kidney disease. If you have a little blockage, like a plaque in there that I'm sure Dr. Crandall mentioned, to one kidney, that kidney will secrete enough hormone that it needs to get blood to it. It could care less if it blows your head off, you know, but that's another cause. Those are secondary causes of hypertension. How do you know you have them? Usually your pressure is hard to control, and you're feeling it then. You really can feel the pressure more with those. Yes?
Are people aware that you can have a stent put in? I had a stepsister that had to have that because I didn't realize that would cause high blood.
You mean a stent to the kidney?
Yeah.
It's,
renal artery.
yeah, renal artery blockage. You know, as Roy can say, as a nephrologist, I find decisions on that some of the more difficult because of, you don't know that it's caused from that till you fix it. And Osler, a pretty famous physician up at Johns Hopkins, his definition never changed. That's called renovascular hypertension. It's hypertension that gets better after you fix the blockage. Nowadays, as they're going in and seeing more renal arteries that have blockages, fixing that doesn't necessarily take care of your problem, and just seeing something doesn't do it. There's a lot published on that recently. You don't go out looking for it, but if the pressure's high, if you have kidney failure, if you go on an ACE inhibitor that somebody brought up and their kidney tests go up, then you look for it. There can be several different kinds. The most common kinds are from arteriosclerosis, and you get a blockage. Again, the kidney will raise the pressure as high as it needs to. You can have something where you're born, and there's 5 different varieties where someone has a congenital blockage. Congenital means you're born with it. And as you get older, it gets more important and your pressure rises. They can stent those, or even with the congenital type, actually, that's one where they can still put a balloon in and open it up. Works very well for high blood pressure. You have to know who to pick. Right. Yes?
How important is caffeine in your diet with hypertension and spices? As I've grown older, I love spices more and more. And what about olive leaf extract? Does that lower hypertension? And grapeseed extract?
The thing I can say, I'll go about the one that I can't say the most on, the olive oil extract. The Mediterranean diet is real. Do you think it's real? I think the Mediterranean. Yeah, especially if your name's Cacciaguidi, I think it's great stuff. The Mediterranean diet actually is very good. And if you have more olive oil in your diet, any kind of a fat that is liquid at room temperature can displace the other fats that are solid at room temperature. Your cake that was made with butter that tastes really good, if you could displace that a little bit more with a more of an olive oil, the omega-6, omega-3 fatty acids, the fish oils, they can be a benefit for displacing it. The grape extract, I can't comment on. The caffeine, if you're taking a lot of caffeine and you notice your pressure goes up with it, cut down on it. Now, my drug of choice is caffeine, so I don't diss that too much. But if you're taking a lot of caffeine and you notice your pressure goes up, back off. And there's probably not much more reason to have a couple cups a day. I won't get up here and say that caffeine is necessarily bad, as I won't get up and say, you know, a drink or 2 a day is bad for you. But if you notice your pressure goes up on caffeine, or you notice your pressure goes up after having a drink, you know, that's you and you have to change to it, okay? Real hot spices can sometimes lower blood pressure. Anything that vasodilates you a little bit can lower it a little bit. When you talk about exercise, the time you want to get your blood pressure isn't when you're doing an aerobic exercise or an anaerobic exercise, which can raise pressures drastically. If you have somebody who's doing weightlifting, if you were to take a pressure right when that person's really pushing, it would scare you how high it is. That doesn't necessarily hurt you. People don't have strokes exercising usually with weightlifting. But after you've exercised, you know, 15, 20 minutes later and you're nice and relaxed, that's the time you want to check your pressure. It's going to look good. But again, you have to be honest with your pressure. That's your best pressure of the day. Don't wake yourself up at 4 in the morning to check your pressure either. Pressure, you can't dial in your blood pressure. It's going to vary during the day with a lot of things. Stress, hormones, your normal cycle. You have to recognize there's going to be some variation. And when you are treated for hypertension, your doctor can't dial in the pressure that he wants because you're going to have all these variations. You don't want to be overtreated, though, where you're dropping pressure, and that's something we have to listen to very carefully. Don't hesitate to tell your doctor about the symptoms that you're getting on the medications. Some of them are important, and some of them, they're an easy fix can do something. Yes?
Increase your water intake to affect?
I would just take a moderate amount of water. You know, just watch your salt intake. You usually, if your pressure is going to go up from water, it's going to be because you have a full bladder and you're under stress, not necessarily from the water. Certainly, if you expand your volume and your circulation a lot, that will raise your blood pressure. And to really get it up, though, if you have a lot of salt with a lot of water, that's going to stay in your circulation. Your kidneys are going to have to dump that in 24, 48 hours. That will raise your pressure.
Dr. Oz says blood pressure 115 over 75 is perfect.
right here in the first row, the best blood pressure I heard described once, and I think it's true, is the lowest blood pressure that you can have without going into shock. Now, there's an advantage, despite all these things you can do to try to stay off medications, to help yourself with it. If you do need a medication to go on it, all that helps. The people that can control it with that and medications certainly do better. The person who has a blood pressure of 90, well, thank you God, I mean, that was a gift you were given. A lot of people don't quite have that. So, I mean, do you still have an increased risk? You do, but not as much. You certainly can change it a whole lot. And I'm not saying just, up a certain percentage. I'm saying, so many fold decrease of certain of these diseases, okay, that you want to avoid. Person
Thank you,
who has a
Dr.
pressure of
Malone.
90.
I'm sorry.
Going on.
Thank you for an
Thanks.
excellent talk.